So we're going to be talking about primary versus secondary aberrant regeneration. And what this means is peripheral nerves can regenerate. And even though central nervous system has some limited capacity to regenerate, really it doesn't do a very good job of it. So this is a peripheral nervous system regeneration. And so this is most applicable to us in the third nerve, because the fourth and the sixth only have one target, so they don't really have anywhere else to go. The fourth has to go to the superior oblique, the sixth has to go to lateral rectus, so it either regenerates or doesn't. And even if it regenerates aberrantly, it still ends up in the same target place, because it really has nowhere else to go. But 3 controls the pupil, the lid, and the extraocular muscles other than the lateral rectus and the superior oblique. And so when you have aberrant regeneration, the third nerve, the fiber that used to go to the lid might go to the muscle, like the medial rectus muscle, or the fiber that used to go to the pupil, or any combination of this. So the most common is when the patient has a third nerve palsy and they look down, the lid retracts. So lid retraction in down gaze, the levator is firing when your inferior rectus muscle is supposed to fire, or pupil when you look down constricts, or pupil when you look in constricts, or you're trying to look up by activating the superior rectus muscle, but the medial rectus fires instead, and so your eye adducts like this. Any combination of wrong muscle firing is aberrant regeneration. And that can happen after any lesion that causes disruption of the third nerve. However, when you have ischemic lesions, it doesn't disrupt the tract. So that means no aberrancy from ischemia. So ischemia is like the little tiny blood vessels that affect the nerve, the vasa nervorum. Yet ischemic, the tract is still intact. So when this nerve regenerates, it just goes right back to its original target. However, if you have a tumor or an aneurysm, it bends the tract, and so when it regrows, it goes to the wrong place. Secondary aberrant regeneration is super common after compressive third nerve palsy, traumatic third nerve palsy, aneurysms, tumors, etc., but not ischemia. Primary means you never had a third nerve palsy. You just show up and you have aberrancy. And this primary aberrancy almost always is from a cavernous sinus lesion. And the reason this is it's got to be slow growing. It's got to be slow enough to allow degeneration and regeneration at the same time. And it's not like an aneurysm, which presses and it either ruptures and you die, or it presents with an acute third nerve palsy and then you fix it. In a cavernous sinus slow growing lesion, there is both degeneration and regeneration at the same time. And so you end up with primary aberrant regeneration. And the 2 most common causes are internal carotid artery aneurysm, but not PCOM, aneurysm in the cavernous sinus, a giant aneurysm, and cavernous sinus meningioma. So it's usually a helpful sign if we see primary aberrancy. When we have an unusual cavernous sinus mass, we can be fairly sure that it's slow growing, and that usually means it's benign, and you should pick meningioma. So you should know a little bit about primary versus secondary, and the difference between normal and aberrant regeneration in peripheral nerves, but especially the third nerve.